Hello friends, today I'm going to tell you about leucorrhea. In this video we will cover Introduction, Type, Symptoms, Causes, Diagnosis, When to call a doctor, Prevention, Treatment. So let's get started. What is leucorrhea? Leucorrhea is a thick, whitish or yellowish vaginal discharge. It is the most commonly experienced condition of women of reproductive age. Women experiencing vaginal discharge, at first instance, feel very embarrassed and worried as to why they are suffering from this problem. Though majority of the women fear and think of it as a disease, usually it is a sign of just an infection. It is normal to experience vaginal discharge few days before menarche, before a woman starts on her periods for the first time, just before periods and during a sexual fantasy or sexual stimulation. Some amount of discharge is normal and essential for vaginal lubrication. However, the amount of discharge may increase due to vaginal infections and may come and go from time to time. This condition can be quite embarrassing if characterized by foul-smelling vaginal discharge. Leucorrhea can often be a pointer to various gynecological conditions and infertility, and hence requires evaluation and treatment. What are the types of leucorrhea? There are various types of this condition, and they are listed as below based on the cause. Physiological. It is a natural secretion from the vagina. This happens mostly due to a change in hormonal levels. Commonly seen scenarios include sexual excitement stage, during early stage pregnancy, one of the signs of puberty in young girls. Also, it is noticed in newborns for a week post-birth due to maternal estrogen. Pathological. It is due to disease conditions. The discharge has a different color and smell. It turns yellow with a foul smell. It can be due to underlying infection and needs medical attention. Some of the pathological conditions are as follows. Cervicitis, pain in the lower back, is a very common symptom of this condition. It will be accompanied by inflammation of the cervix caused due to sexually transmitted diseases or allergy to intrauterine devices used for contraception or any other contraceptive method. Yeast infection in the vagina. It is also called candidiasis and is commonly found in diabetic women or people who are taking antibiotics and contraceptive pills. The associated factor is related to change in the vaginal pH. Also, poor hygiene can lead to this. Trichomonas vaginitis. It is well known by the name of trichomoniasis. It is seen with yellow discharge that is frothy along with itching sensation. The causes can be attributed to sexually transmitted disease and poor hygiene. It takes a time period of 3 to 28 days after the infection for the symptoms to show. What are the symptoms of leucorrhea? The following symptoms suggest that you might be suffering from leucorrhea. Foul-smelling vaginal discharge. Pain in the stomach or cramps. Constipation. Headaches. Itching sensation. Pain in the lumbar region and calves. What are the causes of leucorrhea? There are various causes for this condition, but the most common ones are as follows. Sexual intercourse that is unprotected. Nutritional deficiency. Poor maintenance of hygiene in intimate areas. Any injury to the cervix or any other part of the female reproductive system during pregnancy. Infection of the urinary tract. Fungal or bacterial infections. Vaginal irritation due to the insertion of contraceptive devices. Anemia. How is leucorrhea diagnosed? It can be diagnosed by examining the vaginal fluid for microbes and WBC count. Greater than 10 WBC under microscope aids in the diagnosis of the same. When to call a doctor? Most women experience pregnancy discharge, and there is nothing to be worried. It does not mean it is not sometimes worrisome or annoying. It is necessary to contact the doctor or healthcare advisor if you have the following. chunky, copious, large quantity, heavy discharge, foul smelling. Can leucorrhea be prevented? This condition can be prevented by following the measures: having a healthy diet, maintaining good personal hygiene, taking care while using contraceptives. How is leucorrhea treated? Home remedies. Coriander seeds are perfect for vaginal infections. The coriander seeds can be soaked in the lukewarm water and can be left as such overnight. Consuming these seeds in an empty stomach might help you to subside the symptoms. Since it is caused due to various causes, treating the underlying cause will lead to the cure of the disease, like the sexually transmitted infections. The treatment modalities include the use of antibiotics like metronidazole, etc., depending on the causative organism. Consult the doctor or physician before taking any of these. Homeopathic treatment of leucorrhea. Homeopathy offers best treatment without any side effects. Commonly used medicines are alumina, calcarea carb, graphites, creosotum, lilium tig, natrum mur, pulsatilla, sabina, sakali suar, sepia, sulfur and trillium pen, etc., which can be taken as per symptoms of individual patient. Thanks for watching. Doctor Online 24/7 by Dr. Sana Bawani.